button so that you can record the session. Perfect. Okay, so now we have all our speakers here and we can begin. So to introduce ourselves, we're the South African Schools Debating Board and we are responsible for organizing and facilitating world school style debating across the nation. The work we do involves organizing a national debating competition, which happens annually and sees over 300 of the best debaters across the country. We're also responsible for selecting the South African national team, and that team goes on to represent South Africa at the World Schools Debating Competition, which also happens annually, and last year happened in Thailand. The speakers who are going to be engaging with you on this platform are individuals who've been selected from our top pool of debaters, and they are now going out there now training for various tournaments that they'll be participating in later in the year. Our belief and our value and our goal is that we think that public speaking and discourse teaches learners critical thinking skills that they might not always gain from the formal education system. Through debating, they learn to interrogate the world around them with a keen interest, and that always puts them a step ahead of the others in terms of wherever they go, whether it be university or into the workspace. They have the confidence and the knowledge to approach the world in a way that is meaningful. Our debaters go on to work at the best institutions around the world, to study at the best universities around the world. We truly believe that our program creates world leaders, leaders who are tolerant because they've learned from a young age to listen to the opinions of others and to use those opinions in the formulation of their own opinions, as opposed to those opinions being based on ignorance or being based on prejudice. And I think our program is trying to do that and trying to create more of that. Our aim, ultimate aim, is to make sure the skills of debating are available to every single high school learner across the country, that they all have the opportunity to engage with debating and to engage with our projects and with our platform, and to make it more accessible to individuals regardless of financial background or of financial circumstances. That's really what we hope to do in the future. So basically, what are we doing here today? So we're here to discuss the COVID-19 pandemic, this pandemic that has completely changed the world around. It's completely changed the way we view our health, the way we view ourselves, the way we view society. And as a panel, we'd really like to see how it's impacted our high school learners and the kind of questions they have about this pandemic. And hopefully, through this platform, we can create knowledge and we can create discourse. From the outset, we must say that our dearest sympathies and our dearest condolences go out to everyone who has lost a loved one, who has been adversely affected by this pandemic. I think even though we can have intellectual discussions about these issues, we should never forget the souls who are at the core of these issues and the vulnerable individuals who feel the impact of these situations far more than some of us do. So we think even as we enter this conversation, let's be cognizant of the people who've truly been affected by this pandemic, and to try and do our best in our own little way to make sure that this pandemic doesn't continue to exist, doesn't continue to thrive in our nation, even if that means just staying at home, even if that means adhering to social distancing policies. We think that's super important that we do our part to make this burden on others far less in society. So as a board, we truly stand in solidarity with all the efforts of all the individuals who are trying to curb this pandemic and trying to make sure that less people suffer in the outrun. So that's basically what we're here today to do, to discuss this, and who will be leading our forum will be our SA national debaters. So firstly, I would like to introduce you to our panel of experts who have so graciously decided to take time out of your busy days to come and speak to us. We really thank you for that, and we really appreciate you being here. Our first expert is Dr. Michael Boswell. Now, Dr. Michael Boswell is one of the doctors who's working at Steve Biko Academic Hospital, and he's part of the task team that is dealing with this pandemic. He studied at University of Pretoria in 2012, where he did his internship at Steve Biko in 2013. And during those 2 years, he earned a master's degree in medical immunology. He then went on to study at the Tshwane District Hospital, where he wrote his diploma in HIV management and was awarded the HIV Clinician Society Medal for Outstanding Achievement. In 2016, he went on to Oxford University to study towards a PhD in HIV progression and infection. And currently now he's working at Steve Biko Academic Hospital, where he is part of the doctors that are dealing with this pandemic. I had the great privilege of working with Dr. Boswell at the beginning of the lockdown, and just saw how much work and effort he put in to truly find innovative and creative ways to solve this pandemic. So Dr. Boswell, welcome, and we're really thankful for having you in our session today. Thank you for joining us. We truly appreciate it. Our second panelist is Mr. Dirk de Vos. Mr. Dirk de Vos is the founder of QED Solutions, an advisory and corporate finance firm based in Cape Town and Oslo. He has expertise in renewable energy, natural resources, and sustainable development. Thank you so much, Mr. Dirk de Vos, for joining us. We're really looking forward to your opinions. I read your intriguing article in the Daily Maverick. It's brilliant. I think it gives really good insights into what the pandemic has done in our nation, and I'm truly looking forward to hear what you have to offer to our learners today. Our third panelist is Mr. John Miller. Mr. John Miller is a photographer, journalist, and founder of Unequal Sciences and African Growing. He's interested in how to achieve healthy, prosperous, and vibrant societies. He's a News Fellow at Code for Africa, BMW Global Responsible Leader, and an Atlantic Fellow for Social and Economic Equality at the London School of Economics. Thank you so much, Mr. Miller, for joining us. I also read your article in the Daily Maverick. I think you guys sort of see where I read my news articles throughout the day. It was a brilliant article about opening up our borders for international tourism and the impact that COVID-19 is having on international tourism. It was brilliant to read. Thank you so much for joining us, and we truly look forward to having you in our discussion. Our final panelist is coming from South African Anxiety and Depression Group. Her name is Ms. Tracy Rose. Ms. Tracy Rose is a business owner of Tracy Rose Coaching, Facilitation and Training Pty Limited. She focuses on the delivery of soft skills, emotional intelligence, communication, and stress management, as well as mental health. She's a volunteer of the South African Depression and Anxiety Group, and she's been part of this NGO for the last 7 years, where she participates in counseling, training, and corporate presentations. In her personal capacity, she's a mom to 2 young adult sons. She was divorced 22 years ago and then widowed before the 50th celebration. Her life experiences, she says, has challenged her remarkably and has led to her becoming more courageous and graceful in all that she does. Mrs. Tracy Rose, thank you so much for being with us. We truly appreciate you taking time out of your public holiday to join us in this platform, and we really hope to hear what you have to say, because I think the mental health impact of COVID-19 has been underrated and undermined to a great extent, and I think hopefully this platform will give insights into what that has looked like and what our learners can do to better prepare themselves as this lockdown continues in some regard to guard their mental wellness and to guard their mental health. Okay, so that's all our panelists. I'll now give them an opportunity one by one to give you a short introduction or a short reflection on their perspectives about the COVID-19 pandemic. And I'll start off with Dr. Michael Boswell. Dr. Boswell, could you please give us your perspectives and your insights?
Sure. Just wanted to say hi to everyone, and thanks, Bettina, for inviting me to come and speak to so many people. Even though I'm quite a junior member of the team at Steve Beaker, I will try to do the topic justice. So I've broken down my reflection into 5 categories. So I thought I'd start with just a quick discussion on what is SARS-CoV-2, the virus. What do we know about this virus? Where do we need to go in terms of research? What do we still need to figure out? And then I'll briefly discuss what my experience on the so-called front line has been. It's not a term I'm very fond of, but I will discuss what it has been like to try and set up a kind of COVID-dedicated facility. And then I'll just finish off with just discussing some of my future kind of hopes for what South Africa's healthcare system will be able to do going forward. So to start off with, SARS-CoV-2 is a coronavirus. Coronaviruses are ubiquitous in mammals. They are mostly found in bats and rats, and then they spread into intermediate hosts. So in the 21st century, we've had 2 coronavirus epidemics before this one, which were very serious. The first was SARS-1, so that was in the early 2000s. And that spread in a very similar way. It started off in a wet market in Asia, and then it spread into humans, and it then created severe hospital-based epidemics, really, and caused a lot of death. Luckily, with good infection control prevention and awareness, that epidemic was brought to bay. Then a few years later, we had the MERS kind of outbreaks, which are still ongoing. Also, with more awareness and prevention around healthcare facilities, those are becoming a lot less common now, which is really quite nice to see. SARS-CoV-2, which underwent zoonotic transmission, which is transmission from animals to humans in January, it was quite clear early on that this was a virus with pandemic risk. The main thing that worried me when I was watching the news in January was that there was clear evidence that this spread between people, and it did so rapidly. That's always a major cause for concern. The sequencing work that was done in China was absolutely amazing, where they showed that this was a new virus. And that's really where the problem came in. Since then, I mean, it's gone on to devastate communities in Asia, Europe, and America. And it is going to continue to spread around the world. I don't think there's any doubt about that anymore. This has caused an unprecedented problem for the global population. The closest analogy or example we have for this, I mean, outside of HIV now, but I think on a global scale, the only thing that's come close to this was the Spanish influenza of 1918. And for anyone that's interested, John Barry has an excellent history of the Spanish influenza called, I think, The Great Plague. I'll have to check that, but absolutely amazing book, amazing history of the Spanish influenza. So what is clear about these kind of pandemics is that they have major, major effects on global economies and healthcare systems. So what else do we know about SARS-CoV-2 and this disease, COVID-19? It really, what was quite striking about a virus like SARS or like Ebola is that they cause illness that is severe enough, quick enough, that you can isolate those people and you can bring those infections under, those outbreaks under control, as we've seen with Ebola in West Africa in the past few years. Now, with this virus, it unfortunately causes mild illness in such a large number of people that it is very difficult to detect, very difficult to stop it spreading. But unfortunately, it also causes enough people who get infected to become severely ill and require hospitalization. The current estimates are that around 20% or 1 in 5 of people infected will require hospitalization. This is likely to be an overestimate because this doesn't take into account people who are asymptomatic. But still, I mean, we've all clearly seen the effects of what this is doing to healthcare systems around the world, and it is a major part of why this is a problem. Not everyone's risk is the same, and it is clearly more severe in people with other illnesses like diabetes and heart disease, people who are obese, and primarily men as well. We tend to make up a disproportionate number of those who are severely ill. The pathophysiology of this disease, how it causes how it kind of causes disease, is really not entirely clear at this minute. Then there are many hypotheses which are being tested as we speak. The next section I'm just going to go through is where do we need to go as a kind of scientific and a medical community in terms of figuring out this disease? So there are 1,000 different research questions at the moment that need to be figured out. So I'll just focus on the ones that I think personally are most important for us. So I think what we really need to know is, why do some people get ill as badly as what they do and others get mild illness? You know, is this a genetic predisposition? Is this a viral property? I think that's relatively unlikely, but it could be. You know, we don't really know. We have some theories, but at the moment we don't really know. I think the next thing that we really need to figure out is what gives you protection from being infected with this virus? What, you know, can we do something to help people develop mild illness if they get infected, or to prevent them getting infected entirely? So what that means is we need to figure out whether the protection from this virus is T-cell driven, whether it's antibody driven. So that really leads into vaccine development. For South Africa, I think our most critical thing that we need to know is, how is this new disease going to impact on people with HIV and people with TB? There are nearly 8 million people living with HIV in South Africa, and we don't know what this disease is going to do to them. So that is an area of active research in South Africa at the moment. South Africa's healthcare system is quite stressed. It's quite dysfunctional. And I'm not just saying that about the public healthcare system. I think the private healthcare system as well is not a fully functional, integrated system. And that is going to make responding to this virus quite difficult. So what we try to do at Tshwane District Hospital, where I work, which is adjacent to Steve Biko, is we've basically decided to create an entire new dedicated facility for COVID, which we have basically been given about 6 weeks to do to kind of achieve that goal. So it has been a major challenge, and just trying to integrate the two hospitals to function well has been very difficult. I mean, just as a small example, we don't really have a culture of capturing data. We don't really have electronic records that we fill out. Everything's still done in a paper file. But this is clearly something where we really need to learn a lot, and we need to learn it quickly. So there have been some amazing efforts from this hospital, from Gauteng Health, and from the NICD in terms of getting us ready, and in terms of getting systems in place to try and do a lot of these things. In that sense, it's really been quite nice getting this kind of facility going. There's been a lot of enthusiasm, there's been a lot of energy put into fixing problems that have been there for decades. So creating a new hospital system has been very difficult, but it has also been very rewarding. And I think that we are possibly going to be just in time to sort of go into when our epidemic is going to start expanding. So in that sense, I don't know, because I'm not really a sociologist or an epidemiologist, but I think our lockdown has brought us the time that we needed where I am. I can't really speak to the bigger healthcare system, but for us specifically, I think it's been very valuable. We've seen a large investment into kind of, getting new skills built up, getting new systems put in place, also new equipment. We've got Wi-Fi in some parts of the hospital now, which is really great. It's been fantastic. It's kind of one of those things that I've been thinking about where, there's been a lot of chaos in the sense that we were told to create something new, but that was also an opportunity to reconstruct something in a way that was fit for the purpose that we needed it to be. And that is useful because this is going to be our new normal until we have a vaccine or a good treatment, which is anywhere from 18 to 24 months. I think we're in this for the long haul. It's very much going to be a marathon, and it's only just going to begin now. So I'm hopeful that at the end of this, our healthcare system is going to be potentially more resilient and more integrated, and perhaps we will have a better healthcare system and a new emphasis on investing in our healthcare system by the time this is over. Okay, that is my end of my discussion.
Cool. Thank you so much, Dr. Boswell. Dr. Boswell is currently on call at the hospital. So he has asked that we ask the students to ask their questions now, just in case he has to go for an emergency. So I'm going to welcome our two students who are going to be handling our health section, are going to be asking questions on our health section. To start with their questions now, our first student is Nathan Phobia. He's a grade 9 pupil at Paul Boys High School in the Western Cape. And our second student is Yufei Gao, grade 10 pupil at Georgian School in Gauteng. Both of these pupils are part of our SA Junior team, and they'll be heading off our health section. So Nathan and Yufei, you can start your section now.
Thank you very much, Bettina, for the introduction, and thank you, Dr. Boswell, for the opportunity to allow us to ask questions. The first idea that came into my mind, a lot of the media coverage or news coverage that we're getting seems to paint a trend that Africa and South Africa's cases are generally quite low. Is this possibly happening or a result of a lack of testing, a lack of covering or understanding of what's going on in Africa? Or is perhaps, like South Africa, certain countries just have experience with diseases like TB and have developed health systems that are able to cater with this? What's causing this general low trend of cases in Africa?
Sure. I think that is an excellent question. I think that is a thing that we go round and round discussing amongst ourselves frequently as well. I think it would be, I wouldn't want to tell you that I know the answer for sure on why that is. But I can at least share my theories on why that is. So the first point I think I would make is that, I mean, the continent is quite heterogeneous. Our healthcare systems are vastly different across the continent in terms of resources and availability. Even within South Africa, I mean, if you go and work in Temba, or if you are working in the middle of Pretoria, you are working in vastly different healthcare systems. So I think that the reason we have not seen a huge number of cases as you have in other countries is that many of our governments responded quite quickly with lockdowns and social distancing. I think that's part of it. I think that we are potentially less kind of densely kind of aggregated in cities, in some parts of Africa at least, compared to, say, London, as an example. I think that may be part of it. I doubt there's a biological reason, just because I think that all human beings are probably equally susceptible to this virus. You know, with some very minor variation. Maybe there's some people who have rare genetic kind of predispositions that mean that they are not going to be susceptible, but I think that's going to be incredibly rare. I think that the testing is also a big part of that story. I think that we just simply don't have the capacity to do very large-scale widespread testing as was done in Singapore. I think that if we were to do more widespread testing, we would find more infections. The last point I would also make is that if you look at the population demographics across much of the African continent, specifically in sub-Saharan Africa, it's a much younger population than you will find in Europe, for instance. And that may mean that we see a much larger number of mild or nearly asymptomatic cases, which are much harder to detect. But I also think that we are at the beginning. I think we will have to revisit a lot of what we're thinking over the next few months. I think that we will, as has been said by many of the leading experts, go into a period of exponential growth, and our cases will go up. I think that's almost inevitable.
All right. Thank you very much. I get your ideas and your theories. They make a lot of sense. But to talk more about the capabilities of health systems, I just specifically want to ask on South Africa. Like you just mentioned now, it's just the beginning, and a lot of people are saying our peak is yet to come and it's going to be far worse. Do you think our health systems are prepared? And if they aren't, what do you think we can do to ensure better preparation or try and achieve a full preparation for that peak?
Yeah, so I will have to be relatively careful in how I answer that. The reason is that I mostly have experience working in and around Pretoria. So I can't really speak to the major, sort of the rest of the country. I think that there's probably going to be a lot of variation in how prepared places are. So I think we've seen that already in Tshwane, where we have been trying to prepare as quickly as possible and as well as possible. We know that some of the smaller hospitals are quite ill-prepared to receive a large number of cases. They just, quite frankly, don't have the resources, they don't have the staff, they don't have ICUs, they don't have isolation facilities. So in that kind of context, I mean, they wouldn't be able to deal with a large outbreak. Your academic, which is why we have, you know, Gauteng Health has decided to create these kind of centers that are supposed to be dedicated. So how it works with us is that if you kind of are in the public healthcare sector and you test positive, you will be referred to our facility. And we, I think, have capacity to deal with COVID cases. We have a few cases kind of already coming through our doors, and we've managed them quite well. The real question is, if we have a massive outbreak, what is going to happen? So there's a lot of talk around ventilators, but I think that it's equally important to remember that a ventilator is not, it is one tool in critical care. You need a lot of skills, you need a lot of people, you need a lot of additional drugs and a lot of additional machines that go into that monitoring. I mean, what I was basically doing for the last few weeks was helping to set up essentially a new kind of ICU. And I mean, talking to the nurses that were actually doing the work, to be quite honest, it's hugely complicated. So are we able to provide the level of care that you have seen being provided in, say, the UK or in Italy? No, our healthcare system is nowhere near that well resourced. We do have the private healthcare system. I hope that we will be able to come to some kind of amalgamated system where we can share those resources, but for the moment, the public healthcare sector would, I think, really struggle to deal with a massive number of cases. Like, not really feasible.
All right, thank you. That's answered a lot of my ideas regarding South Africa's preparation. But now to ask a question more about the virus itself rather than its strain on our systems. At the beginning of its outbreak, when it started getting a lot of coverage, a lot of people said the symptoms were very much like the flu, and you're barely going to notice it, and it's not going to do much like harm to your health as a person. But as it started getting covered more and we understood more about it, we realized it's a lot more dangerous than that. So my question is, what made us realize how much more dangerous it is, and why is it to be more concerned than just a simple flu?
Oh, sure. So yeah, I mean, that was a very popular narrative in January going into February even, where people were saying, well, look at how many people die from flu every year. So it's important to remember, I think the two major sort of statistics that caught my eye in January were the number of people that required hospitalization. That number is anywhere from 20 to 30-fold lower in influenza, and it also affects different age groups. So this virus, so that's the one thing. The other thing is that humans generally have some kind of pre-existing immunity to influenza, either through vaccination or through past exposure to similar influenza viruses. With this virus, there's no pre-existing immunity. So if you release influenza, say, into a population, it might come into contact with a lot of people, but it won't necessarily cause most people to have actual symptoms, whereas this is a little bit different. This has the capacity to infect and cause symptoms in just about everyone, because there's no pre-existing immunity. So that's the one aspect. The other is that the number of people that die after being infected with SARS-CoV-2 is dramatically higher than it is with influenza. So those two numbers together, when you multiply them out across an entirely susceptible population, is what we have, is what causes the problems that you're seeing, where you just have, seemingly hordes of people coming to hospitals. It's just that it can infect and cause severe illness in much more people than influenza can.
Well, thank you very much. That's all that's on my mind. So I'm going to pass over to my friend Yufei to let her speak what her questions are. Thank you very much.
Pleasure.
Hi, so I am Yufei, and the first question that I would like to ask you, Dr. Boswell, is should people infected who are over 65 renounce treatment in order to give the resources to younger people?
Oh, wow. No, I don't think so. I think my personal frame of reference, and this is something I was discussing with a colleague who's like a sort of like a trained ethicist, is, we need to individualize quite a lot of this. Blanket kind of statements around people over a certain age group are very dangerous. My personal feeling is that were we to create such rules, they can very easily be extended to other populations. They could be extended to people with HIV, people with TB, people with cancers. And considering that those are the people that are most vulnerable to severe illness, if we keep extending this kind of set of definitions, eventually there will be no one, I fear, who will, be entitled to kind of either new medications or ventilators and things like this. That said, that is, an idealistic point of view that I've presented. In reality, if we have 30 or 40 ventilators and we have 500 people who require them, we will need to triage them. Then I think it comes down to individual decisions. They're incredibly difficult to make. And I am very, very happy that I am not one of the people that has to make those decisions. So how it would work where I'm working, because I am working in quite a well-resourced area, is that our critical care services will make those decisions on an individual basis. And there will be some exclusionary criteria at some point, but we are not there yet. And I, to answer your question, would not want to have a blanket statement that people at the age of 65, for instance, should not receive all the care that they possibly can, because I feel that they're the most vulnerable.
I think that's a very good perspective on this debatory topic that's been going around, especially in areas like Italy and in Spain, and where there have been a lot of people who are doing these things. And then from a medical perspective, do you also think that patients with underlying illnesses who are infected be prioritized before like the normal patient?
Yes, so I mean there is a degree of that. So for instance, in our kind of algorithms, which I was fortunate enough to help develop. If you present to our kind of units and you are classified as having mild disease, but you have a significant kind of additional illness. So let's say you have cancer or you are over the age of 65. The decision to discharge you and send you home, even if you have what looks like mild illness, is something that needs to be thought of quite carefully and usually has to involve a senior clinician making that decision. The reason is that they can deteriorate quite quickly. They can get very ill very quickly. And yeah, I definitely think, I primarily work in HIV medicine, and I'm quite concerned about a lot of my patients who have HIV but do not have a kind of controlled viral load. So that's usually when you take antiretroviral therapy with HIV, you want to suppress HIV replication. So I'm worried about that population that has not managed to suppress their viral load. So I think we need to pay extra care to them to make sure that they can try and suppress their viral load and that they can get the vaccines that they need for things like influenza, which can be a real disaster if you get infected with that and COVID at the same time, or so we think. So yeah, I definitely think we need to provide as good care as we can to the people who are most at risk before they get ill.
I agree with that. And so the second question that I like to ask is, there has been a lot of controversy regarding whether the virus originated in nature or was genetically engineered in the Wuhan lab. And which claim do you think is more likely given the current circumstances?
Sorry, I didn't hear. What was the first part?
There has been a lot of controversy regarding whether the virus originated in nature or was genetically engineered in the Wuhan lab. And
Sure.
which claim do you think is more likely?
Oh, so it's not my opinion which one is more likely. It's been relatively conclusively shown that this was a kind of natural spillover event. These coronaviruses relatively frequently transmit from bats to humans. And there was no indication of kind of genetic manipulation in this virus. So what you can do with viruses is you can sequence them, and their genetic sequence reads like a barcode. So when you take a set of related viruses with related genes, you can create something called a sequence alignment, and you can then use statistical methods to determine how related they are to each other. So what is quite clear with this virus is that it is distinctly related to other coronaviruses, which we know about in nature, which we have sequenced before, and that it is very likely to just have been a kind of a spillover event is one of the things, or a zoonotic transmission. I think from a probability point of view, this has been inevitable. This is something that a lot of people who study pandemic viruses have been warning about for decades. So it's not surprising that it happened. So we don't need, it didn't need to have come from a lab. We expected this to happen at some point.
Oh, that's very interesting on this topic. And the last question that I like to ask you is, considering how much the virus's genes mutate from person to person, will it ever be possible to create a cure that kills this virus off for good?
Such a good question. So as Bettina kind of mentioned, that is the area that I kind of study is viral evolution. And it's something I find hugely fascinating. If anyone is interested, there has been a massive international program to sequence this virus and study its evolution in real time. And that is called the Next Strain Project. And there's a really nice New York Times article that I read this morning, which is written for the for lay people as well, which really explains this in depth. So to just kind of signpost to those references in case anyone would like to follow them up. Yes, this virus is mutating. RNA viruses do mutate quite naturally. We see this with HIV and influenza and a whole range of others. They do it quite rapidly. So the important thing to remember is that these viruses need to replicate. And they have a certain kind of cellular or certain kind of machinery which allows them to do that. So yes, the virus can change, but most of the genetic changes that you see won't necessarily affect the proteins that this virus needs to replicate, which is the important part. At the moment, there's very little pressure being put on the virus to mutate into kind of a more sort of virulent strain or anything like that. There is mutation ongoing. Whether there's going to be adaptation to the kind of drugs that we are currently using, so you'll probably have heard about remdesivir. Whether there's going to be escape mutations against remdesivir or not, I honestly don't know. I think we're going to find out. And in terms of vaccinations, the kind of consensus opinion from the experts is that this virus evolves relatively slowly on the protein level, and that if we do generate vaccine, it will take some time for this virus to generate resistance around that or escape mutations around that. That said, I don't really think we can say conclusively one way or the other. Unfortunately, we just don't really know enough yet. I think we will learn more about that over the coming months and years.
Thank you so much, Dr. Wolf, for giving me so much insight into the health aspects of the coronavirus. And so John, you will now be continuing with the economic section.
Thank you so much, Ife and Nathan. That was great. Just before you leave, Dr. Boswell, we have a question from Tabelo Mofoking in grade 12 from Sunrise High School. Tabelo, you can ask the question just before Dr. Boswell has to go. Tabelo, are you there? Your mic might be on mute, so you might have to unmute yourself.
Can you hear me?
Yes, we can hear you.
My question is not only regarding South Africa, but internationally. Italy, for example, is one of the countries that have the most infections and deaths. Now, as we all know, it is a developed country, and it should be equipped to handle such a pandemic as compared to us, South Africa, a developing nation. In your opinion, why do you think they are still having challenges with the curbing of the spread of COVID-19?
That's also a really good question. I mean, they've done the lockdown. They've done what they can to kind of reduce transmission. And from what I understand, their kind of number of new daily infections is going down. So the important thing to remember with lockdowns is, even if you institute this mass social distancing that has been done even in South Africa, it only really starts to take an effect 3 to 4 weeks later. And if you look at it as a kind of normally distributed curve, however long you take to go up, you also have to take that time to come down. So you will still have a large number of cases going into your lockdown and coming out of the lockdown. It's just that the total number of new cases per day will go down. So that's the first part, I think. The second part to that is that Italy has particularly in the north, as far as I understand, I might stand at a correction here, but they also have a relatively old population. So if your average age is quite high and you have a large number of critically ill people, those people might be in hospital for a very long period of time before they either die or leave you. So you can still have a large number of deaths going later because they've basically just stayed in ICU the whole time. The other aspect to that is that approximately 50% of the deaths in Europe have happened in care homes. And I think that is incredibly difficult to reduce transmission to, because you need a large number of people moving in and out to care for those people. And you also have visitors and things like this. Sweden, for instance, has been really struggling with care facilities. The UK has been as well. So I think that it's important to kind of understand those nuances when you're looking at like the mortality statistics, for instance, is that there's quite a lot of stuff that goes into that, including time spent in ICU, how long you're staying in hospital, and what's happening in care facilities.
Thank you. Thank you so much, Mr. Boswa.
Thank you so much. That was a brilliant question. Unfortunately, we do have to move on to our next section. I know that Maggio Copano from Sunrise View has a question for you, Dr. Boswell. I'm just asking him to type out his question in full, and if you could respond to it as a message before you go, as we move on to our following speakers. But thank you so much, Dr. Boswell. That was amazing. I really appreciate you taking time out of your day on call to be with us today and to answer the questions of our students. We all really appreciate it. Thank you.
Yeah, no, that's an absolute pleasure. I hope it was helpful. Just to reiterate, as I saw from the NICD today, it's a rapidly evolving situation and also a rapidly evolving virus in some ways. So a lot of this information I might be totally wrong in the next 2 months. So hopefully some of what I've said remains current. And I will just answer that question, and then I will be off for my handover. But thanks very much for inviting me. Really appreciate it.
Thank you so much, Dr. Bozo. It's a pleasure. Cool. So now we're going to move on to our economic section, where we're going to be analyzing the economic impact. Now, two speakers that we would like to have their reflection on in terms of that is Mr. DeVos and Mr. Miller. Mr. DeVos, could you please give us your reflection on COVID-19 thus far and its impact?
So, yeah, I am quite interested in the intersection between science and what science can tell us. So what Dr. Boswell was talking about, and decision-making, and what decision-making is about in the context of so much uncertainty. And I think, when, Dr. Boswell gave us quite a current position, and to do it from a clinician's point of view is particularly useful. But his modesty, and it's not just his, from what I can make out, his natural inclination, but the fact that we don't know quite a lot, and we have to make decisions under these conditions of uncertainty. And how does one deal with those kind of decisions? For the moment, there are certain things that we do know. Dr. Boswell covered some of it, but the fact of the matter is that we do know how pandemics work. We know the difference between pandemics, which are global, and epidemics, which are, in the case of MERS and SARS, which we spoke about, which Dr. Bosman told us earlier, were epidemics. They were limited to one area, and pandemics, just like the Spanish flu or the flus that followed on in 1957, 1968, and potentially the very serious flu that came in 2009. That, how does society respond? Because at the moment, we don't have a treatment. That is, we don't have drugs that are clearly able to give us an advantage. And obviously, we don't have a vaccine yet. We do know something about how vaccines develop, but vaccines are probably, you know, in the best case scenario, given what this disease profile looks like as a COVID, as a coronavirus, sorry, is, you know, it's 2 years away. So how do we deal with society? How do we deal with the kind of decisions that need to be made when a lot of these things are not clear and there are consequences for any kind of decision? And one of the big things I learned probably too late, and I'm hoping I can pass this on to younger people who can pick this up, there's always an opportunity cost. And we need to understand that there is an opportunity cost. We cannot ignore the opportunity cost. And often when we solve for a problem, you know, like when we are doing our maths example, we're solving for X. The only thing that we're doing at that time, when we're solving for X in an equation, is solving for X. What the real world is about is solving for a whole lot of different things at the same time. And I find that quite interesting, as how we privilege one decision over the other, and why we decide to privilege a response to the coronavirus or COVID-19 as opposed to some of our other chronic diseases that also need to be dealt with. And so I've written a couple of articles, probably 3 or 4 since the beginning of the year, about some of these things, which I do find interesting. And as I say, it's about how you make decisions when you don't really know what the science says. Right.
Okay, so is there more you'd like to say?
I think I'm going to leave it there, because I mean, I know that I've got other panelists that are with me, and so we are sharing the panel at this point. So let me put it at that here, and potentially some of my other thoughts and observations and questions around the lockdown and how we deal with the lockdown going forward might be teased out in the questions. And obviously my fellow panelists will have their own ideas. So let's leave it there, and we can come back and look at, you know, outstanding questions and maybe more pointed questions that might arise. So if that's okay with you.
Yeah, that's perfect. I think you've given us a lot of points to think about going into this conversation and going into the panel discussion. Our next panelist is Mr. Miller. Mr. Miller, could you give us your reflections on COVID-19 thus far? Mr. Miller, you might. Yes, we can hear you. Thanks.
Okay, great. Sorry. Thanks for inviting me to this panel. It's been really interesting listening to Dr. Boswell and Mr. DeVos, and I'm really excited to get a chance to speak with young people, to be perfectly honest. You might be able to tell from my accent that I am not actually South African. If you read that article and you did your homework preparing for this, you would know that, no, I'm joking. I have lived in Cape Town for 8 years, and I'm currently banned from South Africa. So I left on a personal trip to come to Detroit, which is a city in Michigan in America, to visit my family, and the borders started closing the day that I left. It was actually an overnight flight, and Trump closed the borders to Europe while I was flying. And South Africa decided to close its borders, I think it was 5 days later. And so I just wasn't able to get home, and now I've been in my grandmother's house living here for 7 weeks. And I'm much more privileged than a lot of people, but it has been a complete upheaval of my life. And so that prompted me to sort of reflect a bit about, well, what lockdowns mean, how it relates to my work, and how it relates to borders in general, and what sort of decisions we're making and how those play out in people's real lived experiences. So I guess I want to give a little bit of background of my work and how, maybe why I'm here in general, and then move on to ways that we can use that introspection, looking at the lockdown and the virus, as a gift. And I do see it as a gift, and I see it as an opportunity. And I'll tell you why when I get to that point, because I think it's really important to keep an optimistic outlook, especially in the midst of so much talk about pessimistic topics like the economy and people dying, etc. Someone in the comments brought up prayer and faith. I actually wrote a piece on having faith in a time of the virus. And the way that I'm using the word faith is a non-religious way of framing, looking at the virus. So I encourage you to check that out if you're interested. Basically, my work, maybe some of you have seen it, has been primarily photography. I do the Unequal Scenes project, and that began in Cape Town. It's been very popular. It's basically looking at inequality around the world with a drone. Last year, I was on the cover of Time magazine with the photo of Johannesburg that I took, showing the vast differences in how people live. South Africa, it's very easy to show that from the air. There might be a road that separates shacks in the township from houses with swimming pools. That's not necessarily uncommon, even in other parts of the world, not just South Africa, including my own. So my latest photos have been in Detroit. Since I've been here, I've been able to get out, and in case you guys are not following the international news, Detroit is one of the most heavily affected cities by COVID-19 in America. So we have had, in this region, I think 42,000 cases and about 4,000 or 5,000 deaths. So I'm going to be speaking now also a little bit more from the American perspective, because my entire experience of this pandemic has been in America. So I apologize if this isn't necessarily as relevant. I think that it might be interesting, though, to talk about a little bit how psychologically we go through the experience of the crisis actually occurring. I've noticed a lot of my friends in South Africa will, they would kind of present to myself and to others on social media this fear of the virus reaching South Africa. Totally justified. 7 weeks ago, we had that same fear here in Michigan. We've since gone through it. We've since gone through the pandemic. We're coming out the other side, at least in this little region that I'm in. And it's important to let you guys know that the world does not end. Everyone you know does not die. And the economy does not grind to a halt and people start rioting in the streets. So I think we need to ratchet down the rhetoric. We need to sort of turn away from the negative messaging on social media that we're all absorbed by because we're all in our houses and find nothing else to look at except for our phone. And then maybe more soberly and level-headedly look at the pluses and minuses of balancing, as the previous speaker, Mr. DeVos, was talking about, our personal freedoms, our civil liberties, our economy, and public health. So those are the four things that really I'm concerned with, and concerned in the meaning that I'm focused on. And finally, I want to get to the point of opportunity and why I think that this virus is a gift. If you talk to any futurist, or if any of you are interested in the future, and as young people, I would imagine that you are, you'll know that the world is moving in a particular direction of automation, of online, of AI, of robotics, of a variety of different ways that are actively working to privilege the already privileged. People with education, people with money, people with internet access, people with secure housing, food, all of that kind of stuff. And the status quo right now is barely working. We're barely holding it together. A place like South Africa is the most unequal country on earth. It's the most unequal country anywhere. You can't find a more unequal country. And America is the most unequal country in the OECD 20, which is the rich countries of the global north. Both of us are just barely holding it together. There's a lot of social discohesion in both countries, I would say, having lived in both. So how does the virus present us an opportunity? It provides us an opportunity to show what it's like when you immediately disenfranchise millions of people from work. You force them to have to work from home, and otherwise they're not going to work. They're not going to have a job. So you're forcing immediately large swaths of your population into unemployment. The latest statistics were released yesterday in America. It's over 30 million people. So that's about 1 in every 8 people who are working in America is now out of work. That's huge. It is by far the biggest unemployment numbers we've ever seen in this country. I would imagine South Africa, I've seen some stats that say 10% will be added to the unemployment rolls. South Africa already has a huge unemployment problem. So you're starting to have an opportunity to see, and by this I'm talking to privileged people in both countries, you're starting to get a chance to see what it's like to be disenfranchised. And it's not nice. It doesn't work. And there are solutions for it. So we're entering a time now where we have a temporary epidemic, and this will be temporary. This will pass. 2 years from now sounds like a long time, but we'll come out of this on the other side. But there's bigger challenges down the road. This disenfranchisement, which I talked about, climate change. So how can we use this temporary pandemic as experiment time to experiment like the US government is doing and the South African government, I'm not as familiar with, but the US government in particular is experimenting with, for example, putting moratoriums on evictions, conditional basic income, meaning that the US government is literally giving money to every citizen, and upping the unemployment insurance for every American. Where the US government is also adding protections for healthcare for uninsured people so that they won't have to pay for healthcare if they have COVID-19. Now, those are like small victories because I'm sure you're aware, America does not have universal healthcare. If I get sick right now, not having medical insurance, I don't have any way to pay for it. I have to use my credit card. That's scary and it's wrong. And it doesn't make business sense. It actually, America spends more on healthcare than any other country in the world, and we get worse care. So these little victories I see as huge opportunities. And as a communicator, as a photographer, a journalist, a writer, I think it's incumbent upon people like me and any of you who, I mean, we're talking to debaters here. You guys are all debaters. You guys are communicators by definition. I think it's our time. It's our time to push the message that these little victories of social justice and equity for future resilient, healthy communities can be sustainable, and we need to do them now so that we're not flat-footed in the future. So I think I'll end it there. Thanks again for the opportunity.
Sure, that's a lot to think about. Thank you so much for your insights, Mr. Miller. Now we'll hand over to our last panelist to give us her insights. That's Ms. Tracy Rose. Ma'am, could you please give us your insights on the pandemic thus far from your point of view? You might have to unmute yourself. Yes, we can hear you. Perfect.
Perfect. Okay, so first of all, thank you so much for inviting us to be part of the panel. I just want to put the record straight. My name is Tracy Feinstein by surname, and my business has a different name. So obviously SADC sent you something bio. But yeah, so I'm Tracy Feinstein, and representing SADC, which is a mental health organization, very functional, very visible in South Africa. And I thought we're at the forefront of taking calls, which is what we do as counsel people, through a difficult situation. And we are, as an organization, we're the only suicide crisis line in the country. We're sitting with over 22 helplines, and we're clocking over 600 calls with people in South Africa to try and help them on a daily basis. And this is only but escalated because of the situation of where we're at, especially in lockdown. And one of the things that I thought, well, let's have a look and also share some insight into mental illness, because that really is where that's the nature of our game, and that's what we work with. So I thought, let me choose something that is really important, common, and it's something that's going to play up and already is playing up for everybody in some shape or form and some level of severity, depending on who it is. And that is the element, the mental wellness state of anxiety. And right from the beginning, we've had to express to anyone who makes contact with SADAG is, what is anxiety? Why do you feel that we're suddenly talking about this word? And so I thought, let me just put a bit of a definition behind it so that we all have an understanding of what it is. And I think it's a very real feeling and emotion. So right now, in terms of a diagnosis, a clinical diagnosis, anxiety exists in the DSM-5. Okay, so you can be diagnosed with a mental illness in the form of a word that says anxiety. How does it feel? It's a heightened level of stress. It's a fear of the unknown. And when we have this fear of the unknown, we have these thoughts that spin around in us, okay? And I always say to people, you know what? The moment that you have these thoughts spinning around in your head, this kind of what if, I'm scared, I don't like this, I don't know what's going on, whatever's happening in your head is going to manifest in your body. And so very often this heightened awareness of anxiety leads to a panic attack, okay? And maybe somebody has a question around that. I'm not going to go into the detail around it, but it is the platform for you to understand that whatever you may be feeling can certainly manifest physically. When we look at what Dr. Boswell was speaking about earlier, it's very normal and it's very real to actually understand that if we experience physical symptoms of, let's say, for example, COVID-19, it's going to create massive anxiety in our thought process. And so again, what happens in the body manifests with thoughts in the head. And, you know, we have to understand that when we don't have a platform to understand, talk about, and get practical help with an illness such as anxiety, the problem is this element of a very foundation of mental illness, foundation illness that sort of can lead to the next thing. It does, it starts building up. So we don't recognize this anxiety. We don't see the behavior changes, either with ourselves or even our loved ones in the home, if we're in lockdown. And suddenly it becomes worse. And before we know it, we're heading into depression. All the time, this is breaking down our immune system. And that puts us into a vulnerable situation, especially when we're facing a pandemic, where at this point in time, we need to be physically strong and well and healthy. So my message is very much that whilst we often talk and we hear a lot of information going out about staying healthy, and we think of it immediately about our physical body, there's as much responsibility for us to be aware that we stay mentally healthy, because the two go hand in hand. So, short overview, it's a tiny snippet of what we're facing. I can honestly say that the heightened anxiety from the moment lockdown started across the country for individuals here in South Africa is escalating exponentially. And therefore, it's important for us to talk, to be able to say, people can phone a place like SADAG, speak to a counselor, settle the thoughts in your head, because you then have the ability to build your immune system and make sure that your body is strong to cope with what you're facing. So thank you again, and I'm going to leave a time for all the youngsters to ask the questions that they want to ask us. So thank you.
Thank you so much. I really apologize for the mix-up with your surname. Thank you so much for your insights. That is brilliant. I'm now going to hand over to the students so that they can get a chance to ask their questions. I have recorded everyone who sent a message saying that they want to ask a question as well. We will give you a chance to do so once the SA team asks their questions. So our students who are going to be leading this session, mostly focused on the economic impact of the COVID-19 virus, will be Johnny Akor, who goes to Cambridge Learn and is currently in grade 11, as well as Rohan, who goes to Bishop's College and is currently in matric. Both of those pupils are part of our SA national team, and we really welcome them to this platform. We also have Kasim Osman, who goes to Dextalda High School in matric and is part of our SAA team. Welcome to you too, Kasim. And then leading us on our psychological impacts of this condition, we're going to have Faye Crawford from Epworth High School in KZN, who's currently in grade 12, as well as Wunpleta King from Edmund Rice High School, who's also currently in grade 12. Thank you so much for all of you for being here. I'll now hand over to Jania to start the question session.
Hi, thank you. Can you hear me?
Yes.
Okay, perfect. So my questions are more about the economy and those factors. So my questions are directed to Mr. DeVos and Mr. Miller. I think my first question is just about how our government has made it really strict and immediate reaction to the virus, but in an already developing nation that suffers in terms of the economy, what do you think was the way up between the economy and the health factors about it? But more than that, we saw like developed and more stable nations like the USA, the UK, and Sweden that didn't even consider that way up. So what do you think, and they were very relaxed, so what do you think motivated South Africa to disregard the economic factors so much, but also what might have motivated such an efficient reaction, something that I don't think that we're used to seeing very often?
Okay. Johnny, I'm going to just kick off with this, if that's okay. I think we've got to be careful about thinking of this as an economy versus dealing with the pandemic, because the rest of the world where we participate in as an economy have closed down, and even if we hadn't reacted as we did, lots of the economy would still suffer. And I'm thinking about tourism particularly, which was, previous to this, one of the biggest employers. And I think 1 in 6 South Africans are employed in tourism. And whether the government had closed down or not would have had no impact on tourism, because basically that industry is going to be struggling for a long time. The decisions going forward about how we lock down and the questions of how quickly we lock down, I think those are quite interesting. And I think we were able, because we were behind the curve of the developed countries, Europe and America, in the sense that our infection rate was well behind theirs, is that we could potentially, at the time when we did it, is that we could lock down, have a look and see what was happening, and do it at a point where our infection rate was still low. Unlike when it was in Italy or Spain or France or the UK, and then particularly the USA at the moment. So it's always easy if you lock down early with these things and you have fewer infections, and you can potentially isolate those infections. Over the long term, and here is a really, really, really difficult problem, and I don't have the answers to it, is this pandemic, until there is until there's a vaccine. And a vaccine is 2 years away. So we've got different countries. One of the sort of outliers or countries that have gone a different route is Sweden. It has a very, very developed social welfare system. It's got a very, very developed health system. And they've decided that, look, we have to take a 2-year view on this. And if you take a 2-year view, and I mean, you know, as kids, or I remember when I was at school, where, you know, you take a different view on your 200-meter race that we had to kind of do when, you know, I think it was in spring when it was the athletic season, and we all had to kind of do it, you know, whether you liked it or not, or when you were going to do and how you would run a cross country. And you know, the early wins that you get by kind of sprinting out and looking like you are going to be doing well in a race in a cross country is completely different to how it looks when you are running the 100 meters or the 200 meters. So I'm quite interested in the fact that we are looking at successes or failures of governments to respond, but potentially too early in the race. It's you know, to use the sports analogy, you know, we are 5 minutes into the first half of a game that is going to last a lot longer. And the way that we exist and the way that we get through this is going to be more like a marathon. And one of the things, obviously, for younger people is we're going to get through this. And one of the things that Johnny had mentioned as well, you know, he referenced a book. I haven't read it. Is, you know, the Spanish flu pandemic. But at the moment, when we think of 1918, we still think of that it's the end of the First World War. We don't think as much that it was the year that the Spanish flu started, which killed 50 million people, far more than in the First World War. So I'm quite interested in some of those ideas and potentially, look, we locked down early. We were able to kind of maybe keep our numbers down, much lower than they would have been, but we've got to remember that this is a marathon, and early wins might not turn out to be the winning strategy at the end of this period. And really, what I also wanted to get across, and to answer your question, is that even if it is a marathon and that it's going to be 2 years ahead and it seems impossibly long until we get on top of this, we need to preserve what so many people have suffered and died for, which is our constitutional, well, I'd like to put it as our constitutional values, and that we need, at the end of this, still to be a country with this wonderful constitution of ours that still exists, because most of us are going to survive it and we're going to be okay. We don't want to lose what is good about our society in dealing with this crisis. Yeah. So I'm going to sort of stop there.
If I can jump in. Also, great question. I'd like to echo the last point. I'm aware of the optics of someone from another country telling yet another country what to do or to give opinions on the government's response, but I feel like since my home is South Africa, technically, I can do that gently. I have been fairly aghast at the type of lockdown that the government has imposed on South Africa. So I'm just going to go ahead and say it. I think that it's too strict. I think that the excesses are too many, and I think it infringes on the aforementioned civil rights, but more than that, the liberties of people living in a social compact, in a democracy, with respect for individual freedoms. So by that, I just want to pose as a counterpoint the USA, because oftentimes people will fall into the trap of either associating our presidents with policy and our numbers of infected with our policy, both of which are much more nuanced and complex than I think people give it credit for in the press. Number one, Trump in our system does not have the ability to lock down the government. We have a federal system. So the state governors, the governor of my state, Gretchen Whitmer, has the ability to put on curfew, close businesses, and tell you not to go to school, not Trump. There is a constitutional right to not put troops into the street to search people without their consent. There's no state of emergency that's been declared by the president. It's unclear whether constitutionally he could dictate martial law in this country. So there's some strong differences in our approach, which I think are good. And I think that they ought to be recognized that the US is doing some good things. The conversation about opening up our economy and coming immediately out of lockdown versus staying in lockdown and saving lives, I agree with Mr. DeVos also, is a false dichotomy. There's some studies that are really interesting that show that recessions are actually good for mortality. And by that I mean, the longer we stay in a lockdown, the longer poor people live. Isn't that weird? So for example, in the recession in 2008 in Europe, the European countries that suffered the worst in the recession had an increase in how long people lived afterwards, because people weren't going to work and getting in traffic accidents. They weren't stressed about their work, overworking, dying of hypertension, blood pressure, of all the excesses that come with work in the global north that takes place. This is not to say that that's an absolute. I'm saying it adds color to the debate. There's also the question of, what are we trying to do with a lockdown? Are we trying to prevent people from dying, or are we trying to prevent people from dying with the expectation that we could then remake the economy more equitably afterwards? That to me would be a reason to prolong the lockdown, instead of just saying we need to keep people from dying and then open up to business as usual afterwards. And that is where I feel like a lot of work has to be done, is saying if we go right back to work as usual, which is the common narrative here, and I am hearing it more and more often in my Facebook feed and from South Africans, what system are we going back to? Can we make that system more equitable? Can we choose a system that allows people to thrive instead of just survive? So I don't know if those points land at all. It's very complex. I would resist the urge to jump into one camp or the other, which social media makes it so easy to do. For example, I saw today on Twitter the photos of the Sea Point Promenade that was crowded. And it's so tempting to jump in and have an opinion on that. It's also so easy to jump into the same queues that I saw the day before in Centurion, with people queued up for food hampers. But I think it's really, really important in this sort of crucial time when we see our social fabric stretching thin to take a breath, take a moment, and sort of be a good citizen. Research the narrative and engage with the nuance.
Okay, thank you so much. That was really great, and actually kind of leads me on to my next question, which is, I think, one of my main concerns about that way up, because I think that the South African government seems to be getting a lot of praise right now globally, but also in a lot of wealthier communities locally. But I want to know what a lockdown looks like for lower income communities in a country like South Africa with a lot of inequality, where people are saying that we need to work because we'll probably die of hunger before the virus even gets to us. And what, in your opinion, is or is not the government doing to help these communities, or what can they do to be better?
So I'm going to jump in there as well. And it's a great question. And it's not a question that can be answered. I suppose, like all great questions, they are not ones that lend themselves to an easy answer. I think it's impossible to ask people who have no food and no income to submit themselves to a lockdown. I think that there's a severe danger that if we respond to their refusal, which is inevitable, to submit to the lockdown, when they don't have any other options, that the lockdown itself fails. And we need to be very, very, very mindful that these lockdowns or restrictions on movement, we know and we understand the epidemiological reasons for them. We're going to have to slow down this virus. We don't want to overload the health system with these peaks. It's often called flattening the curve. But I do think that what South Africa will probably lead in is an idea, well, if we're flexible enough and we're not too rigid, is how a developing or a poor country ought to respond to this crisis. Clearly, we can't pretend that we're like Norway or like many countries in what we call now the global north, and I include potentially China in that. Obviously beyond, the traditional Western Europe or Europe and America. But I think a lot of what we have at the moment is some sort of adoption that we do live in suburbs, that we do live in houses with bedrooms and so on, that we don't fully appreciate, and we don't create regulations and rules that are likely to be followed. And I have a problem with this in two ways, both because it seems to be needlessly, I hesitate to use the word, but needlessly cruel or unthinking of the situation of many of us who live in informal settlements or who have no access to food. But I also always keep my eye on the long term. And as young people, it's a good thing to do that as well. We're going to get out of this. We need to be sure that that which is good, and I've made this point before, that we retain going forward. So if we have mass non-compliance, or worse, a sort of insurrection against these rules because these rules are impossible to comply with, we're doing great danger to our society. And when we focus on the disease in the absence of looking at what are the consequences, what are the long consequences of basically a breakdown in the rule of law, and it's a very fragile sort of balance. How we don't make the law an ass, really, and there's this very famous quote, and I forget the exact context of it. Is it's a French philosopher. His surname is France himself. I forget his first name, and he talks about how the law in its great majesty and equality says both to the rich and the poor that you can't sleep under a bridge and that you can't steal bread from the shop. We need to understand that there are differences and that these rules are going to be more difficult and work more unfairly on the poor and of our society, and of which there are many, compared to the rich. And so that's a sort of a roundabout answer. Johnny?
My whole work in the last 4 years that I've been doing has been focused on inequality. It's a huge problem. Barack Obama called it the pressing issue of our time in 2013. It's as big in my mind, it's as existential as climate change. So when you ask a question about how the South African government is treating the majority of people in the country that are not succeeding, the wealth distribution in South Africa is extremely skewed. The majority of people are not succeeding. How do we then use this opportunity, this pandemic, as an opportunity to analyze what went wrong and how we can do better in the future? That's number one. But number two, and I totally agree with Mr. DeVos, is that we need to separate what works and what's necessary with a lockdown, and what's arbitrary and what is capricious, and potentially what is informed by particular ministers' ideas about morality, or maybe even more nefariously illegal sort of operations. Now, I'm not going to spread rumors. I will say that South Africa has an excellent and robust civil society and free press. That's why we were both found in the Daily Maverick, which is one of the, in my estimation, one of the best newspapers in South Africa and one of the most free and independent. Let's rely on our journalists. Let's rely on people to analyze what's going on. There's been lots of stories in the Daily Maverick about how there's disembolations and breaking down of shacks in places just outside of Johannesburg and also in Cape Town. There's been a lot of analysis of the way that homeless people have been treated in the city of Cape Town, and rights being abused in places like the Strandfontein relocation camp. I've done particular work on relocation camps in the the Cape Town region. And in general, trying to separate what is necessary and what isn't. And I'll just maybe I'll end with this, is that the US government has, and I should say the state governments now, not Trump, the state governments have implemented partial lockdowns. We use the same word, but I'm able to go outside right now. I'm able to exercise. I'm able to go to the store, drive a car, walk my dog, buy food, do limited forms of work, use e-commerce solutions and have them delivered to my house, order hot food. All of that is open. South Africa is following a more, I'd say, Chinese/Italian, Spanish model. If you look at the models for new cases after the peak has been reached, the US is exactly the same as Spain, Italy, and to some extent China. Not as a country as a whole, but state by state, because different states have had different times when the infection rate started, which leads me to believe that it's not the strictness of the lockdown, but particular parts of the lockdown, perhaps closing schools, closing most businesses, not allowing people to gather in large groups, forcing people to wear masks. Those are the things that are actually preventing transmission, not being able to buy alcohol, not being able to buy cigarettes or order from Take-A-Lot, or not being able to buy school books, and all the crazy things that the South African government has put down as regulations. So I'll stop there.
Thank you so much. Yeah, that really does have you thinking, like, how do you even lock down in a country with so many people living in informal settlements where you don't have money for food to last you these months because you've been living hand to mouth. But thank you so much. I learned a lot. I'm going to direct the next set of questions about the economy to Rohan.
All right, can everyone hear me?
Right.
Awesome. I just want to start by saying thanks so much for your time. I think my first question is probably directed more towards Mr. Miller, which is that, like, the South African and US governments have taken a very, very different approach when it comes to, first of all, like, painting the picture of what this is going to do to their respective economies, and then also how they're dealing with it. So, like, in South Africa, we've been, like, pretty upfront about it, saying it's going to be really tough. These are the issues. like this is how much we see, it's how many jobs we see ourselves losing. This is the contraction we see in our GDP. Whereas in the US, there's Trump saying, no, everything's fine. He loves to talk about the stock market in his daily briefings. And up until quite recently, he loved to bash Jerome Powell at the Federal Reserve for not doing enough. And that seemed to have somehow gotten Jerome Powell to turn on the money printer and have this unprecedented reaction to this crisis where they are now buying junk status bonds. They have, like, I think it's the biggest buying program the Fed has ever had in the US. And it's quite controversial because lots of people are saying that, first of all, they're creating more very important financial institutions that are becoming dependent on the Fed, but also saying that by buying all these junk bonds, they're kind of distorting asset values, which might be sort of putting off the recession for now, but it's just going to come back to bite them in the future. So what are your thoughts on what the US government, particularly the Fed's doing right now, and why South Africa seems resistant to do anything like that?
Wow, these are hard questions, and I'm not a trained economist, but thank you for asking them. You obviously pay very, very close attention to the way that the U.S. government is responding to this. Let me answer it in a slightly different way. I am fearful that the U.S. government is using this as a pretext to do business as usual, to prop up the same businesses as before, to do dicey financial transactions, as you've sort of alluded to, basically to create a TARP part 2, which would be the recovery plan that was implemented by Obama after the first financial recession in 2008, which was devastating to poor communities. It was devastating in the sense that it focused on bailing out corporations without protections for the workers, without protections for the ways that those industries supported communities. And so this time around, from what I understand, there are more protections, thankfully, because of a democratically controlled House, which have been imposed on some of those $2.5 trillion relief program items. So I'll start by saying that it's better than last time around, and that the US government does have an opportunity, with an appetite with progressives in the Congress right now, to make some small concessions to the inevitable bailout that will occur. That being said, American society consistently depresses me. And we have an extremely able, exciting, dynamic, responsive, great country with so many resources, and we consistently fail on the most basic provisions of need. South Africa can, at the end of the day, always turn to the history, the recent history of the country, to say, we've got a problem that was inherited. America can't do that. We have no excuses. So I don't have a good way of telling you this is going to be better this time. I do have an appeal to use your obviously prodigious smarts and economic savvy and color that with an optimistic lens to help influence the people who need to be influenced, which is the common voter. Let's use our bully pulpit, let's use our smart, progressive leaning politics, and then project that to people who can actually get things done and change governments. So yeah, I'm hopeful in the face of stiff winds of pessimism.
So Ronan, it's a great question, that, and maybe this is where I feel a little bit on stronger ground. Obviously, the United States as a reserve currency has the freedom to do things that South Africa can't do. And so while our Reserve Bank has started to buy government bonds, so effectively do some of those kind of, or start to do some of the things that that America has been doing, and they have been doing, from the 2009 financial crisis, we are starting to do it, but we don't have a reserve currency, and what we can achieve with it is limited. I do have some serious concerns at the moment. And once again, as I'm mindful that I'm talking to young people, that you are going to inherit effectively this mess that we have created, or my generation and the generations above me have created. And one of the things that you notice now is, for instance, the stock markets in the United States, and to a lesser extent here, have performed reasonably well. Effectively, they have de-linked from the economy. So you might have new record statistics and figures coming out from America where people have lost their jobs, and you have food line or people looking at their own kind of emergency aid for food. Americans living, one paycheck away from basically being in a poorhouse. Yet the stock market is performing relatively well, not as great as it has been. And what happens after this? So you're shoving all this money into the system, and it's got nowhere to go because the economy is effectively closed down. So what does it do? It sort of lands up in the stock markets, and it pushes, in the same way as it's got to go somewhere, this excess liquidity that has been provided. And so it goes into the stock markets, and those people that are there and have the incumbents are effectively going to look at assets and opportunity and use this crisis to pick up really great businesses that are involved in innovation, businesses that have been built by entrepreneurs, the smaller business sector, and effectively to advance what really has been a problem for a long time, and potentially in America since the 80s, elsewhere maybe a little bit later, where you're starting to kind of see a consolidation of economic power and inequality at the top. Because in any of these efforts, including quantitative easing, it advances the interests of people who have assets already, and it comes at the cost of the rest of the economy. And we need to be very, very careful. I mean, one of the things that we could do is to revisit in America what they did at the beginning of the 20th century when they started to break up their conglomerates, Standard Oil at the time, and to use antitrust. But it's very hard to sort of develop a political platform on, let's use competition law to improve our economy. It doesn't have the same attraction as something that is potentially more populist. But we really do need to start to think about the dangers and the potential for further consolidation of wealth, the reduction of the number of companies competing against each other going into the future, and frankly, it's going to be left to you, your generation, to fix this, because it's going to be one of the legacies, a failed legacy of the generation, my generation, which didn't do and didn't make those decisions, and thought that we could kick the can down the road for decades effectively, and not actually deal with the consolidation of power at the top. And the fact that every time there's a crisis, whether it's a financial crisis, and now we look to shore things up. But what we do when we shore things up is that we promote the interests of those with capital, particularly those who are at the top of the tree, at the expense of the rest of the economy, the main street, I think the Americans call it. And we are going to have to make very, very serious efforts to reverse that. I think, from what I can make out from Johnny, I think he would agree with that.
Just one more point. You know, we had a presidential candidate in Bernie Sanders who garnered millions of supporters. So there is a progressive, populist, left-leaning political sentiment in this country that wants to see more equity and wants to see that top-down pyramid shift the other way. You know, we've been hollowed out in this country. Unions have been busted up. Pensions have been shifted over to speculative 401k investments that busted in the 2008 financial crisis. My grandmother, the house that I'm sitting in right now, lost all of her investments in General Motors when that company went bankrupt and was bailed out by the government. So it's not like there isn't the appetite, right? It's not like Americans are selfish, full stop, which is sometimes that black and white type of unnuanced conversations that I hear when I travel abroad. We're savvy, we get it. South Africa has an opportunity, I think, as well, and I don't know the lay of the land as well, so I'm not going to go too much into details. But from the American crisis, what I can say is rely on local networks, support unions, support community organizations, support local leaders. They're the ones who know how best to spend money. They're the ones who know what the problems are and how to get the resources from the top to the bottom. So if that means we need more power at the provincial level, if that means we need a stronger opposition party, if that means we need more individual rights in South Africa as far as how we invest, how we spend, how we work, and how that all plays into the future of work is what I talked about in the very beginning of this talk, then I think that's a conversation I'd be very interested in following and adding my 2 cents to, because it, as Mr. DeVos just said, it's the future that you're inheriting, absolutely. And keep your head up, really, keep your head up. I'm talking to you sitting in a city which has gone through, Detroit, Michigan, has gone through bankruptcy. It's the only major city in America that's gone through bankruptcy. Just 2 miles down the road, if I ride my bike, there's huge empty fields. Houses have just been wiped away because there's been no work. It's a majority black city, 85% African American. There's no work since probably about 1970, 1980. But there's still hope. There's still positivity. There's still community organizations that are doing great work. And they still have a voice at national government pushing, continuing to push. And I think that persistence eventually will win out.
All right, thanks so much for that. Yeah, I think it's going to be interesting to see how that changes. I think particularly in the US, where you have that sort of that movement that was sort of started by Bernie Sanders and AOC, and see where that takes us. I have one more question, which is just more specifically about South Africa, which is, you know, we got downgraded and then again further into junk status recently, like very recently. And I'm just wondering what effect COVID's going to have on that, because we knew it was coming anyway, whether this crisis was going to happen or not. Is it as simple as this is just going to send us further into junk status? Or is it possible that because of the optics of it, it seems as if South Africa is in junk status because of COVID, so that might help us recover in the future? Or is it the case that because other countries are also being hit hard, possibly even harder than us, relative to other countries, it's not so bad for us anymore? Or is it the case that simply COVID is just terrible for us and is going to send us further into junk status?
So I'm gonna give or venture an answer. I think that it is bad for us. I can't say that it's not going to be bad for us. It's going to be horrendous for us. I mean, we've now been kicked out of the World Bond Index. And so effectively, a lot of people are going to have to, depart from buying South African debt or certain sovereign debt. But it is in an environment where a lot of other countries are going to be struggling as well. I think one of the things that potentially could be quite hopeful, Ronan, is that the whole nature of how you quantify risk and the agencies that give some sort of risk assessment, whether it's Moody's or the others, whether their measures and their understanding is in fact the adequate. And I think that what we're going to be looking at in the future is going to be interesting, is whether the rating agencies, which we've used as a kind of as a proxy, so we don't even look at what they are, how they judge or how they look at these things. We just effectively kind of look at their rating and their, whether it's numbers or letters on what is junk status and what isn't, and how many levels below and how many levels above that one is. And I think there's going to be a revisit of how they understand risk, because any of the prior understandings that they might have used, like debt to GDP, the questions of the amount of the size of the government sector as opposed to the economy as a whole, and those other measures that they use, I think are going to have to be revisited in a big way. But I don't want to take away from the fact that we are looking at a very, very, very serious problem, and those problems have preceded this crisis. What I have a real concern about, Ronan, is this, and it could be disastrous. And in fact, if I had one thing that I fear the most, it comes down to this, and it goes to your question, that our government and South Africans as a whole start to take the view that the reason why we are in this trouble that we are in is because of the COVID crisis. Our problems have existed prior to this. The necessary adjustments that we needed to make to our economy existed well before this. And if we don't take the serious decisions that we need to take to make our economy more flexible and structure it so that it doesn't replicate the failures that we've effectively had for well over a decade and potentially longer, that we use this disease or this pandemic as the basis for that's why we're in our the position that we are in. And I'm concerned that this is a kind of, the reasons why we don't make the kind of good decisions that we need to make, and the reasons why we don't deal with the serious economic problems that we've had for some time, because we don't have to, or we give ourselves the reasons. This is because of COVID and not because of those problems that were very serious and existed prior to the outbreak of the pandemic.
Yeah,
I don't have too much. I don't have too much to add on this, to be perfectly honest. I will say though that when currency is devalued, there's always pluses and minuses to that. It makes exports cheaper relative. It makes some commodities that South Africa produces, like golds that are priced in dollars, better for the country. Oil is extremely cheap right now, which is good for South Africa as an importer of oil. So it's extremely complex. I think people who are the smartest people in the world at predicting stock markets and futures are getting their butts handed to them right now. So for me to tell you, I know how South Africa is going to react to this, no idea. So I echo the sentiment, though, that I just heard, that we need to be really careful. We need to make sure that our media continues to be fair and free, and journalists have the free rein that they need to be able to investigate what happened, when it happened, and what's the truth. Because that's the only way we're going to be able to actually suss this out 2-3 years from now when we look back at actually what happened. But thank you.
All right, thanks so much for that. Yeah, I think it just becomes our responsibility to make sure that that COVID never becomes an excuse, and that we face the facts about how we actually got into the situation. So thanks so much for your time. I think I've got to hand over to Faye. So cheers.
Hi. So our questions, mine and Bontle, are going to be directed towards Ms. Feinstein about the mental health and the psychosocial effects of COVID-19, which are obviously so relevant to all of us, particularly when we're all sitting in lockdown. So just sort of in the interest of time, I think we're going to bunch our questions all together, if that's all right. I have two. My first one is the mental well-being of all of us in isolation and in lockdown has been big on the brain. And a lot of the advice that we've been exposed to has said to do things like exercise or eat well or meditate. And I think when you do your original address, Ms. Feinstein, you speak to that as a physical response to a mental and emotional problem. And in light of that and the awful effects of anxiety that you speak about, do you think that those pieces of advice are valuable or enough? My second question is what is regarding the effects after the pandemic has passed, as we speak about it's going to be able to. Everyone is talking about this narrative of the epidemic changing the way that we appreciate our ordinary lives and the way that we think about inequalities and privilege. Mr. Miller speaks to the fact that the stark inequalities of South Africa have never been more clear than they are now. And I was wanting to ask whether you think that that narrative, as wonderful as it is true, and whether we're going to change the way that we engage with one another and the way we think about ourselves, or whether we're just going to go back to the way that we were before.
Okay, Faye, thank you so much for that question. Well, those both of the questions. And I think we are pressed for time. So as much as I'd love to talk endlessly about it, I'm going to try and be really specific and try and also hone in on areas which I would imagine are affecting our scholars, which is the target that we're talking to you guys out there, the younger audience. What I'm picking up as I listen to all the previous speakers, both to Johnny and to Mr. DeVos, is that the one thing that is actually affecting all of us, it doesn't matter what your area of preference is certainly that level of mental alertness. So our thought processes are getting affected. And how we're going to survive right now through this is through a choice to focus on our own mental strength. And I think I'd like to say that we're looking at a couple of categories of people. And we have people who already have a predisposition to mental illness. And those people are severely impacted right now for various different reasons. We then have those people who suddenly have been affected by the external that is going on around us, and because of the external are suddenly becoming, wow, my mental state, my anxiety levels, or I'm isolated and I'm completely alone and therefore I'm feeling depressed. Those things are now suddenly starting to become heightened and aware. And then we have the other people who are living amongst an environment where a couple of these factors are playing out. And somehow this is affecting all of them. And so one of the things that is very, very conscious is that dealing with any level of mental illness, and for right now, and the purpose of this conversation, I want to exclude the chronic illnesses. So things like bipolar, schizophrenia, significant addiction to any form of substance, the various mood disorders and OCD. So I'm really focusing on anxiety and depression, which are right now impacting all of us in some way, shape, or form. And the holistic approach to mental illness is that we need to be aware that very quickly it affects all of us at some stage in our lives. And right now, for a lot of us, it's that stage where we're getting affected. So how do we deal with it? For some people, there may be a need for them to take medication. For some people, there is a need to couple that with therapy. And last but not least, is for each one of us to actually own our mental wellness. And that is where it comes in, this thing of going for exercises, eating healthy. Routine is critical at this stage. And routine of lifestyle, doing the things which you've normally done. And I'm thinking about so many of the matriculants that are approaching the year-end phase now, before they get back into school, which I don't know whether it's going to be Monday or a month from now, but whatever. It's so crucial to establish your routine. And your routine is things like your sleeping patterns. What do you do before you go to sleep? If you're falling asleep on the couch, watching the TV and then having your phone and being on social media, you've got this blue light in your face. Plus you've got fake news, good news, bad news, and all of that is affecting your mental state. So there's no downtime, there's no calmness. And so when I talk about routine, it's not just set my alarm at 6 o'clock and get up. There's so many different elements. And I'm happy to actually share with Bettina certain tips and ideas which you could circulate amongst all of you. I think the other part of the question which comes up is, what is it going to be afterwards? How is this going to impact on us? And I think when we look at our diagnosis or the diagnostic state of mental wellness during the COVID time and lockdown, is that for some people, this will be a trigger for a long-term mental illness. I don't know, and I'm not going to discuss what shape or form, okay? But for most of us, this is a time where, as much as we need to manage our physical day-to-day activities, we need to be very conscious of managing our mental state of health. And as you finish the year and you move into the workplace and further studies, it's all about that ability to have strong emotional intelligence, to be able to be resilient, to be able to bounce back. And if you don't persevere now through this phase with the simple tips that I talk about, the impact on our healthcare system is going to be horrific. Before COVID, we were sitting with over 460 suicide attempts in this country on a daily basis. So if we don't get control and start to care about one another and learn about the fact that the mental state of wellness is as important as our physical state, when we talk about our healthcare system being marginalized and impacted on because of COVID right now, the potential to add on it.
I'm very sorry. I think
you
you
lost
muted
the
for a second there. Oh, sorry.
Okay. I don't know if you heard the end part of it, and I'm not too sure. I may have been talking about the horrific state of suicide attempts in the country as it stands at the moment. Just to pick up, if I repeat, I'm sorry. But it's to place the severity of taking care of mental wellness, which is so important during this state. And not allowing you to get caught up in this hype. Right now, even before lockdown started in South Africa, we're looking at 460 attempted suicides in this country every single day. Okay, our healthcare systems are already compromised. We cannot afford for our state of wellness to break down to that level where we cause additional impact on our healthcare system. So it's important for everyone to own their own mental wellness.
Hello, can you hear me?
I can.
Okay. I have two questions. I think the first one is more in relation to what we've been seeing in the news. We've been seeing an increase in like death rates. We've been seeing an increase in information about people who have been affected by this. I think the question that I want to ask is, have organizations like SADC made an appeal to like for a distribution of more positive information that could like minimize the amount of anxiety that people have with regards to this? And then that also boils down to a question about how, specifically from people who have recovered from the COVID-19 virus, have we made aims to like remove the kind of stigmatization that can be associated to these people? For example, I've watched shows on like Checkpoint talking about the stigmatization that is associated with these people. Have we made aims to prevent that? And then the last question that I have is in relation to high school students and the access that we give them to organizations like SADC. Are we doing more to give them access to these like platforms, and like how effective has that been? That's like all I have.
Okay, those are wonderful questions, and also very, very real. I think that we are very, very aware of the need to constantly be communicating at the level of how people are being affected. And so when you talk about what are we doing and are we getting enough positive information out, I can honestly say that SADC is really at the forefront of sharing so much information, because there's one thing that is common to any sector, and that is that information is power, knowledge is power. So the more you can learn about whether it is the coping mechanisms or the nature of the illness or the signs, the symptoms, the lifestyle tips, the financial responsibilities that everyone is stressing about as well. We are constantly sharing that now on a daily basis. And I think the important thing is that this is giving everybody a platform for so many of the smaller organizations and people who are wanting to help out there to partner and join and spread the message so that we are able to touch as many people as possible. The challenge in South Africa is that we have a diverse culture, and the language barrier is certainly still significant. When you're talking about mental wellness, we have to take into account that we are talking about feelings, emotion. And this is where a lot of the stigma comes in, is that when you're not able to express yourself and understand that a lot of mental illness is having insight into what is unique for you and how it's affected you, this leads to the stigma. So it's a constant challenge. We try and break it down in different platforms, and certainly we are using literally every platform available to try and connect and provide information to the people that are looking for that. So whether it be how to navigate the hospital system, how to understand mental illness, and also how to cope in your community with what is going on. So it's pretty vast. And I think these type of platforms where we are given the opportunity to once again say, SADC is a buddy that's out there. With 22 helplines, we are able to connect with anybody and try and answer questions that is going to give them clarity and comfort to save their mental wellness.
I'd like to jump in there just on the sort of stuff that I've been looking at. And when we're going to have, we're going to have these lockdowns and we're going to have these restrictions on movement for some time. And the measure of success is not whether it works epidemiologically. We know how that is, but whether these things that Tracy is saying are addressed. And we need to look out for each other, and anything that is designed cannot be scientific or an epidemiological. We need to understand that all of us are people. And I suppose, my last message is that we need to look after each other. I mean, these very difficult processes, and it's going to be very difficult for each other. We don't know how we as people are going to be able to manage and cope with this. And we need to look out for each other, and just, amongst ourselves and particularly young people, we need to just keep an eye out for your friends, the guys that were tough and all of those. Let's just make it amongst ourselves an effort to just keep an eye on each other.
I think it's very caring and compassionate, Dirk, and it's true. When we talk about a mental state, I like to call it more mind health. We've just got to reach out and care. The information in terms of statistics, academic knowledge, etc., is all out there. The difference is that we have to understand that this is unique, and there is no past history of what we can work from. But when we talk about caring for individuals, we can look through decades of history of how success and surviving whatever is going on, whether it is war or pandemic or illness, sickness, financial crisis, the one thing is that we reach out and we care and we help. And that's going to help to break the stigma. I think my parting message is to say that no matter how difficult the times are, as much as there's so much focus on the mental or the healthcare system to prepare for the physical that is going to happen with COVID-19, we need to encourage people that if their mental state has been affected, they need to realize it's as important to get medical help as soon as possible as well, and not leave it unattended. I don't know if there's other questions.
It's not really questions, but it's like a final statement. And I'd like to say from the SA Schools Debating Board, we'd really like to thank all the speakers for all the, stepping out of your busy time. And we thank you and we appreciate all the information that you've given us. I'd now like to hand over to Bettina to conclude the vibes. Thank you.
Thank you so much. Thank you to all our speakers. It's really been very great. We have a lot of questions that I see in the message chats, but we have run out of time, unfortunately. What I can say is I'm going to leave our email address in the message box. Whatever questions you guys have, please email them to us and we will send them to our speakers. And whatever response we get from them, we'll forward it to you immediately once they get the opportunity to respond. I do know that we have one more speaker, Kasim, who does want to ask a question in relation to economics, but everybody else, you are more than welcome to leave the platform if you do have to go. So we really thank you so much for being interested in having conversations like this with us. As a board, our hope is to encourage discourse, to encourage discussions around very important issues where we can create a better understanding through engaging with individuals that have expert opinions as well on these topics. So thank you to everyone who's joined us, Mr. Javos, Mr. Miller, Ms. Feinstein. We really appreciate you taking time out of your day. Mr. Javos and Mr. Miller, if you do have time, we do have 1 or 2 questions from Kasim who would like to engage with you from the SA team, but everyone else, really thank you for your time and being here. Okay.
Hi, can you hear me?
Yes,
yeah.
Okay, so I just wanted to ask a question on for example, in South Africa, we have a large population of foreign nationals, right? So although the government has like provided some sort of economic support for citizens in the form of like relief, what does that look like for like foreign nationals? And with regards to foreign nationals, what's the impact that this virus has on them economically, and how does that look like? I think especially with like America having such a large Latino population, which is also a population of foreign nationals. So like, what's the impacts on them?
So I'm going to sort of answer that because I think it's a really important question. And we've, just leaving aside America for a while, one of the early countries in the East that effectively dealt with this problem quite well early on was Singapore. Now, obviously, Singapore is just a really small, is a big city rather than a country. But effectively, Singapore has gone into lockdown again. They effectively got rid of the pandemic. They got it down to almost zero, and then it flared up again. And the reason is that Singapore relies on a very large foreign workforce that is actually part of their society. You know, Singapore has achieved so much, but effectively it relies on an immigrant population to do the kind of jobs that exist in the background, the street sweepers and so on. And it's been reintroduced. And we cannot solve this problem if we just think about South Africans, because this disease doesn't care whether you are South African or anybody else. If we cannot solve it amongst our immigrants, we are not going to solve this problem at all. And it is completely non-discriminatory in that respect. So I think that's a great question, and it does mean that when you are looking at measures to support, to potentially look at how you can provide the kind of support, and it's limited in South Africa, obviously, unless we include the foreignism in amongst us, we're not going to solve it at all. And it's something that is not necessarily because, you know, when you're in crisis, you look after your own, you focus on your own citizens and how you can shore that up, whether it's for health services and so on. But unless you solve it for everyone, or you address it for everyone, solving maybe a tall order, but unless you address it for everyone, you fail. And I think that is a very, very important message that I'd like to get across.
Yeah,
I think.
Sorry, I agree. From my experience, South Africa has treated specifically foreign nationals from other African countries very poorly. There's a long history of, I'd say, xenophobic violence, obviously, but also kind of a feeling amongst a lot of people that I've talked to, and a lot of comments that I've read, and a lot of engagements with communities, that foreign nationals are behind a lot of crime, a lot of social ills, a lot of problems with the economy and access to jobs. So there's kind of a pervasive negative feeling towards specifically African foreign nationals in the country that I've certainly felt, and which is manifested in a lot of different examples. But you can see the church in Cape Town, where they demanded to be repatriated to their home countries, to the outbreaks of violence, to comments from the police chief in Johannesburg that are, in my estimation, extremely irresponsible and potentially even criminal. Mr. DeVos is completely right that if you're not thinking of foreign nationals in a pandemic where everyone is a vector of transmission of the disease, you're really just cutting off your nose to spite your face. You might be solving some populist problem amongst your electorate, but you're not actually taking care of the way that the virus moves through a population, which doesn't adhere to where you're from, where you were born. It does matter where you're living, and it does matter how what conditions you're living in. Foreign nationals make up a large part of informal communities. So I would say that South Africa should follow the lead of places like Jordan, which has almost a third of its population as refugees, both Palestinian and Syrians. And Jordan has agreed to care for those refugees the same as it cares for its own citizens. South Africa has that capability. It's a relatively wealthy country for the region, and it's possible. It's political will, in my opinion.
I think that Mr. DeVos, in one of your the Daily Maverick articles that I read, you spoke about how in order for a lockdown or like social distancing to be successful, you need the full support of the population. And so I think at the point in which a government isn't taking into consideration the immigrant population and isn't supporting the immigrant population, they lose a large majority of the support. But also a lot of the sectors that employ the most amount of people in the economy, such as tourism and manufacturing, are closed down because of COVID-19, right? So what happens when citizens start losing support? What happens when citizens start losing, start giving away, stop supporting the government, and they decide that they don't support this lockdown because they live day to day and they just can't survive?
Well, I mean, I think that that's effectively, South Africa's got the strictest lockdown measures of any country. But like we know in South Africa, the strictness of the measures against compliance is important. And even, in my view, that a successful process of slowing this disease, and you can call it a lockdown or you can call it social distancing, depending on how, that's just, those are just definitional, they're not even definitional terms, they're what we call them, is that we need to have measures that work for us. And it's far better to have a less strict regime of lockdown or social distancing that is more generally supported. And I make this point because we're going to be in this for the long term, and so it's going to have psychological consequences that Tracy was talking about, and it's got the fact that we would like these lockdowns to largely succeed. We cannot get everything, and if we don't take into consideration the fact that we have got a lot of foreign nationals with very little options, the lockdown will fail. And the lockdown fails in two ways. It fails to stop the disease, but it also means that as a society, we effectively lose the idea that the government is the final arbiter, the final has monopoly on force, that our society spins out of control when people start to say, well, we're not going to comply. We are, and that puts us in a very, very, very dangerous position. And I'm more concerned about those things almost than just about anything else. But it's a great question. Thank you.
Yeah, and just to add, I'm going to, Kasim, just gently disagree with you. I certainly don't think that you need the support of your population to enforce a lockdown. You can definitely enforce a lockdown by force. And I think if you took a poll right now of informal settlements in South Africa, you would see that it's a very unpopular program and that it's being held together with force. So I don't think that's sustainable. It risks eroding civil liberties in the country in a way that will be detrimental to the long-term economic, but also reputational health of South Africa. And it's something we should be careful about. We should also be careful about balancing the needs of public health with that fear, right? So that's why we need to rely on experts. It's why we need to rely on stepping away from social media and defusing some of that, I guess, natural indignation that occurs when we see a particularly egregious tweet or Facebook post. and try to look at the facts, try to look at things from a human perspective, and try to see our future communities the way we want them to be, and then move forward towards that goal instead of just reacting all the time.
Yeah, I think you make a very valid point when you say that it's forced. And I think that it's important to note that like the entire SANDF has been deployed to enforce this lockdown. But when the entire army is out there like enforcing this, we know that the military is not trained to be in populations, and the military is trained for like war settings. So a lot of the time the army is quite brutal in the regard that they enforce this lockdown. So I think that the impacts that like having the army enforcing this, I think the impacts are far greater than like the virus itself, because at the end of the day, you're having loss of life due to the army. Do you agree with me on that?
Yeah, well, is that a question to me, Kasim?
Anyone, both actually.
Yeah, I'm also very concerned in the same way that you appear to be concerned about those sorts of issues. The call up of additional 73,000 reservists is done in a way that doesn't give me a lot of confidence, and I might sort of potentially differ a little bit here from what Johnny's been saying, is that this thing could fall apart a lot quicker than we are than we accept at the moment. And I'm a little bit concerned that we are losing our civil liberties, and I think that we need to always remember that we're going to come out of this. We know that we're going to come out of this. We have a basic profile of the disease and what its fatality rates are. We need to really focus on keeping what we have, which is good, and keeping that into the future, because we'll need to be a constitutional state to be successful into the future. And if we risk that and we fail to live out constitutional values, I think that is going to be far more dangerous and far more damaging for us in the long term than the pandemic itself.
Yeah, I just think that there's too much stick and not enough carrot in South Africa.
Yeah.
If Cyril Ramaphosa came on the TV tonight and said, we're going to take part of that 500 billion rand package, and we're going to make sure that everyone who needs to be fed is fed, everyone who will get a certain allowance every single month to be able to cover their rent, their school fees, basic necessities, your healthcare will be taken care of. You will get through this. You might not be going to work for the next 3, 4, maybe even 12 months, but we'll cover that in the interim. Now, that might be pie in the sky. That might be economically unfeasible, but it would go a long way towards offering people who are desperate for answers and security about how they're going to feed themselves. And this is truly existential in South Africa. In America, sometimes it devolves into hyperbole. But in South Africa, it is truly existential. I think it would go a long way towards bringing the population to a place that could be managed effectively. Because at the end of the day, we're going to have to make hard decisions. I don't envy any politician anywhere in the world right now. They have to walk a very fine balance, right? I just think that the South African government needs to really be careful about listening to elements of the party that's ruling right now that are calling for unsustainable and capricious regulations that don't seem to adhere to the message of keeping us safe from a public health perspective. That's what I think is frustrating people. So, yeah, I'm optimistic that that will happen, though. I really am.
Okay, thank you. I think that's all from my side. Do our speakers have any closing statements before I conclude the session? Any messages to the community or anything? No? Okay.
Thank you.
So thank you for joining us. Thank you for being agreeing to be a part of this panel and making the time to join and watch us. And for our panelists, thank you for sharing your insight and your specialties with us. And thank you to the SASDB for organizing this and giving us as speakers the opportunity to actually come out here and voice our opinions and the opinions of the youth and ask the questions that have been on our minds since this thing has begun. So the video for this entire broadcast will be available on the SASDB's YouTube channel. So the link for that will be posted on the South African Schools Debating Board Facebook page. And so you just check the Facebook page for more details. Also, for all those that ask questions in the comments, the answers to those questions will be emailed to you. And if you've sent your email address, we'll email the answers and the reflections from that to everyone along with the link. So thank you for joining us. Thank you for watching. Thank you again to our speakers. Bye for now.
Thank you.
Thank you.
Thank you.